Hi, my name is Bethany Wagler. I'm Keith Wagler's wife. He's the precinct chair of the Black River Township in Harnett County. And I began my Doctor of Nursing practice education this week. Well, yes, last Tuesday. And that was my first day of class. I had to read 3 chapters in a book called Health Promotion, Translating Evidence to Practice. It's written by Marilyn Friend and Diane Whitehead. It was published interestingly, in 2021. The title of Chapter 2 is The Social Determinants of Health, Health Equity, and Social Justice. So right off, Advanced Practice Nursing 101, and they're teaching me about socialism. So I just wanted to make everyone aware by reading some of the excerpts from this chapter, just to let you know how serious this is, and that the focus of the left is definitely to turn healthcare away from privatization and towards social medicine. And one way they're going to try to do that is by getting us, the newbies, to do the research to back it up. So that's what they're starting us out in this chapter. But they wanted to preface it and make it sound really good as something everyone should want and a global benefit. The very beginning, I just was reading along and not really paying too much attention, realized a sentence that said, unequal distribution of power, money, and resources, and that's what got my attention. I knew the title of the chapter was kind of an uh-oh. Then, after reading that, I thought, are you kidding me? They're really going to say that? And sure enough. And it says, as a health promotion practitioner, in-depth knowledge of these concepts and related systems issues is paramount to providing the leadership required to shift policy. See, they want nurses to be shifting policy, programming, and ultimately health outcomes, especially across the lifespan of particularly vulnerable populations. Then it talks about those groups being shaped by the unequal distribution of power, money, and resources. It says, at a broader system level, same page, second page of the second chapter, at a broader systems level, nurses need to know how the health of their patients can be improved by advancing progressive policies that address social determinants of health. I turn the page and I'm reading along, and I come to a chapter that talks about equitable distribution of income. And sure enough, the whole paragraph, annual income that's not adequate to meet needs and how it can damage health and cause social consequences. It says that inequality is increasing. It is well established that narrowing the gap between the rich and the poor will improve the health and well-being of populations. Then I read along and I read about how the World Health Organization has gotten involved in 1946 with the help of a political economist named no other than Friedrich Engels. Okay, and we know that he was closely related in his ideas to Karl Marx. It says that the social dimension of health were strongly affirmed in the original World Health Organization Constitution. However, the ensuing technology-based era that affected all of healthcare, including public health, diverted global attention from the connection between social determinants of health and health outcomes for decades. So it got muddied in the 80s with data from computers coming into importance and the infrastructure of hospitals being built and things like that, community hospitals. So the focus was not on these social determinants, and they want it to get back to that, is what they're saying. So they say the difference between inequality and inequity, it says inequality is simply a dimensional description employed whenever quantities are unequal. Inequity requires passing moral judgment that the inequality is wrong and is unjust and preventable. Then it talks about how change was resisted. The inequalities were more likely when the political left was in power. It goes on to talk about other barriers in Europe, how they actually embraced some programs that did redistributive principles, okay? And that neoliberalism was part of the barrier. And when I looked up what that was, we asked Alexa, actually, and so we'll put that on here, what Alexa says it is.
According to Wikipedia, neoliberalism, or neoliberalism, is a term used to signify the political reappearance of 19th century ideas associated with free market capitalism, a prominent factor in the rise of conservative and libertarian organizations, political parties, and think tanks, and predominantly advocated by them. It is generally associated with policies of economic liberalization, including privatization, deregulation, globalization, free trade, monetarism, austerity, and reductions in government spending in order to increase the role of the private sector in the economy and society.
It goes on to talk about living in social settings of inequality and how it forces people to constantly compare their status, possessions, and life circumstances with others. And it engenders feelings of shame and worthlessness in the disadvantaged, which can lead then to these social determinants of health. It can lead to health disparities. Remarkably, deliberate connections between social justice and health equity in nursing literature are mainly addressed in discussion type or concept analysis papers, rather than with empirical research. So see, this is all theory. They can't even back it up with anything concrete. This is all just theory. We continue to examine how best to teach and learn the concepts of social justice. Nevertheless, we continue to call for action around social justice. So I just wanted to make everybody aware of the push. And to wrap this up, again, a statement by the UN and the WHO. I think this was in the 1980s, or maybe it was 2008. It says this. The Commission ultimately recommends improvement in the condition of daily life, including tackling the inequitable distribution of power, money, and resources. They want a paradigm change away from individual interventions, increasingly target government action on non-health issues that drive health outcomes like housing, wages, education, and transportation infrastructure. So we all need to be praying about what we can do to educate ourselves on how to respond when we come to this kind of idea. I was at church today and Pastor James was talking about the talents, the parable of the talents, and how some people buried theirs, and the last person buried his, but the other two did something with their talents and they were blessed by it. They were given authority. And more blessing by it. And the last person who did nothing with their talent was cursed and it was taken away from him. And how that's a biblical, like a sound idea by God. Jesus told that parable, laying down the fact that we're all given blessings that we're responsible for every day. And you can't blame and you can't be a victim all the time. You have to take responsibility. Now, sure, there are those that need it, and we do already have social policies in place in this country, but to turn the entire healthcare system over to government control is just a scary thought. So I just wanted to inform you and let you know that it's getting serious, and we're going to have to start really coming up with responses and putting our heads together on how we're going to combat this. Thank you very much. Have a good night.